everybody. My name is Dr. Roney. Today I'm going to talk about really how to optimize male performance, right? Male health. So one of the things over the last 20, 25 years that I've done, and I've looked into even personally, I've done this for my athletes, I've done it for my patients, is try to take all the literature or all the the Google searches, if you will, that you could Google, what to take and what to do. And there could be literally hundreds of different things that you could do. So what I want to do with this is tell you over the last 25 plus years, what I condensed it down to. What are the most important things that you could do for male health, right? And the big concept, if you will, or strategy is to keep inflammation in the body down. That's the number one thing that I will tell you for male health that you need to focus on, right? Because hypothetically, say you do have high inflammation, you're going to have more fatigue, you're going to have joint pain, you're going to have lower levels of testosterone, you're going to have just a less vigor, less oomph, if you will. You could have prostate issues, etc. So in general, lower than normal testosterone levels, all of that could be just from inflammation in the body. Okay, so what I want to do is take you through a couple strategies that I implement and I've implemented for years and articulate to my patients and my high-level athletes that I work with as well as what supplements do you want to focus in on. Okay, so number one, we need to make sure we understand that what you put into your body, and this may be remedial, but it's always worth just repeating, what you put into your body is either going to be anti-inflammatory or it's going to cause inflammation, right? So I use this paleo-like concept. If you're on a deserted island, what could you eat? You could either pick it or chase it, right? So if I'm on a deserted island and I'm thinking about things like bread and processed sugars, right? And juices and sodas and cakes and cookies and crackers and all these different things that are in our diets significantly in America especially. Those are all things that are going to promote inflammation. So you want to do away with a lot of those inflammatory promoting foods. Grains, dairy, soy, things like peanuts and corn, processed sugars, right? Anything that has a lot of sugar in it is going to be very detrimental to your overall health, but it's going to create inflammation as well. So paleo-like, if you're not familiar, you can always Google it. In today's day and age, you can find recipes and you can find strategies online, but paleo is definitely one of the areas that I would focus in on. Good fats, moderate protein, low carbohydrate meals. And those meals should be mostly veggies and some fruits mixed in for your carbohydrates. Okay. Number two strategy, we want to do exercise, of course. I know that's remedial, but high intensity exercise. Do about 7 to 10 minutes a day of high intensity exercise where you get your heart rate beating fast, and they call it in the intense zone. All that means, to keep it simple, is be huffing and puffing, right? So do that for 7 to 10 minutes. That has been proven to lower inflammation, increase growth hormone, increase dopamine, increase serotonin. It has all these very positive physiological or biochemical effects on the body, and it's going to help lower inflammation significantly, right? The other strategy with working out is make sure you're doing some resistance training, right? So we're taking our fat, burning it with a good paleo-like meal meal plan, and then we're converting it to lean body mass, which is lean muscle. That's going to help keep inflammation down. It's going to help keep your lymphatic system drained, your heart really good, etc. So two strategies working out: one, higher intensity, and two, some lean body mass training, which is light bands, it could be just squats and lunges. It could be light band work. It could be light dumbbell work. Doesn't have to be heavy. You just want to do some resistance training, full body resistance training. Okay. All right, so you have your paleo-like eating, your exercise, and now here are the supplements that I would highly, highly recommend. Number one, I would do turmeric, or the active form of turmeric, you might read it as curcumin, okay? So they're interchangeable. Curcumin is just the active form of turmeric, about 1,500 milligrams a day of turmeric. Also, in conjunction with turmeric, you want to take resveratrol. So resveratrol is the polyphenol found in the skins of red grapes, and it's a very strong antioxidant, very strong anti-inflammatory. So combined with turmeric, very, very good to knock inflammation down in your body. So about 250 milligrams a day of resveratrol. There's a couple companies. One I like to use is Apex Energetics. They have Tumero SE and Resvero SE, both in capsule form, both liposomal delivery, which means it gets through the cell wall and into the cell very easily, okay? So those are two biggies. The third one that I highly recommend across the board daily is vitamin D. Vitamin D is one of the most powerful immune regulators that your body needs almost consistently throughout the day and throughout the week and months and so forth, because your body's constantly fighting this inflammation from our environment, right? We get overloaded. D is what helps regulate your immune system at the cellular level. So it's very, very important to stay up with your D. The fourth one is something called glutathione. It's the body's most powerful antioxidant and anti-inflammatory. When we're inflamed constantly, it constantly causes the glutathione to reduce because it's trying to keep the inflammation down. So it's like a compensating factor there, right? So if we introduce glutathione into the body, it's going to help regulate our immune system and keep our inflammation down. So there's two brands that I like to use. One is a cream. It's called Oxycell from Apex Energetics. Another one is from Quicksilver, the company Quicksilver, and it's a spray. Glutathione, excuse me, about 500 milligrams a day is a really good amount to use. And then the final one of all that I use, these five, the final one is omega-3 fatty acids, okay? Roughly 2,000 to 3,000 milligrams a day. There's a great product that we have at the store. It's called Medi Omega. 1 teaspoon gives you all that. So it's very concentrated. Does have a little bit of a fishy taste, but it's has lemon. They put lemon in there to kind of offset it a bit, but it's very strong. You only need a teaspoon. Even if you did a half a teaspoon a day or so, you're getting omega-3s into the system that are very good anti-inflammatory, very good for the brain. One of the fatty acids called DHEA, that's really good for the brain, but also EPA is very good for anti-inflammatory. So just to recap, you have your paleo type eating, low sugar, right? Take away the sugar, take away the processed stuff. That's gonna help you a ton. Make sure you're gluten-free, dairy-free, soy-free, things like that. A lot of plant-based, if you will. You can still do meats. If you do meats, do free-range, free-roaming, organic. It'll get more omega-3s in there, which are anti-inflammatory, and it will take away some of the hormones and antibiotics and junk that they feed the animals, and you'll get a better, less inflammatory type of protein there, okay? And then your carbohydrates, like I said, mostly organic veggies and some fruits. You can throw in some sweet potato there, maybe a little bit of rice, a little bit of quinoa here and there, but definitely stay away from all the processed grains. And then the workouts, right? High intensity, as well as some lean body mass, so you can change that fat into muscle, and that'll help you a ton as well. And then take your anti-inflammatories, resveratrol, curcumin or turmeric, vitamin D, glutathione, and omega-3s. If you focus just on those areas, most of you will do significantly better. You're gonna have better brain health, right? You're gonna have less joint pain. You're gonna have more energy. Your testosterone levels will probably come up quite a bit. You're gonna have less issues with the prostate, etc. So all these benefits by just reducing inflammation in the body, by what you eat, how you exercise, and some of the supplements that you take, okay? So hopefully that's 25 years of taking it from here to here, and some of the strategies that, like I said, I even use with my high-level athletes. They do wonderful with this. They recover very quickly because they're not constantly inflamed, and inflammation causes injury, right? So for us, same thing. We're not necessarily athletes, but we're trying to stay healthy and not have degeneration or early aging. The way to do that is at the cellular environment with the techniques that we just talked about. So if you need anything, come see me. If you have questions, concerns, I'll help you in any way I can, but good luck And hopefully that was easy, like a nice little package for you.